Welcome back, my good people, and in today's video we are going to look into details about nose bleeding. Basically, we are going to talk about how you can manage nose bleeding at home when your child is nose bleeding, when an old man is nose bleeding, or even yourself when you are nose bleeding. And into details, we are going to look at the hospital setup on how to manage nose bleeding. Into details, we are going to look at precautions that you should take in order to avoid more nose bleeding. If you love this channel, kindly click this notification bell, written subscribe, turn it on for more videos that we will post, because if you turn on the bell, you will be notified whenever I post a video like this. And again, for my returning subscribers, thank you so much for coming back and watching this video. Do not forget to put a little comment about this video. Now let's jump into the video and let's do it. Welcome back, my good people. Nosebleed or epistaxis is what we want to discuss into details together with causes and management, so stay tuned until the end of this video. It's also known as epistaxis. Is an instance of bleeding from the nose, and sometimes blood can flow down into the stomach and cause nausea and vomiting. In more severe cases, blood may come out of both nostrils. Rarely, bleeding may be so significant that low blood pressure occurs. Blood may also come up the nasolacrimal duct and out from the eye. Kindly note that the word epistaxis is from the Greek word epistazo, that is bleed from the nose. Bleed from the nose. Now, there are some causes of nose bleeding that can occur due to variety of the reasons, and the common causes are trauma from the nose, picking, blunt trauma such as motor vehicle accident or insertion of a foreign object, more likely in children, relative humidity including centrally heated building, respiratory tract infection like chronic sinusitis, rhinitis. Environmental irritants can cause inflammation and thinning of tissues in the nose, leading to greater likelihood of bleeding from the nose. And most causes of nose bleeding are self-limiting and do not require medical attention. However, if nosebleeds are recurrent and do not respond to home therapies, an underlying cause may need to be investigated. The following causes are listed here, but these are very rare, but they can cause nose bleeding. Thrombocytopenic purpura, idiopathic thrombocytopenic purpura. Those are coagulopathic causes like von Willebrand's disease, hemophilia, leukemia, HIV, chronic liver disease like liver cirrhosis, which causes deficiency of factor 2, etc. are very important in that manner. Dietary causes like sulfur dioxide, sulfite as food preservative, salicylates, granulomatosis or SLE. Drugs like warfarin, heparin, aspirin, those are anticoagulants. Insufflated drugs, particularly cocaine, may cause this. Nasal sprays, particularly if you spray steroid for a longer time, can cause this particular problem. Cancer causes like squamous cell carcinoma, adenoid cystic carcinoma, melanoma, nasopharyngeal carcinoma, nasopharyngeal angiofibroma can also cause this. And we say that nosebleed can be a sign of cancer in the sinus area, which is rare, or tumor starting at the base of the brain, such as meningioma. Due to the sensitive location, nosebleed caused by tumors are typically associated with other symptoms such as hearing or vision problems that we must look into details. Traumatic, like anatomical deformities, e.g. septal spurs, blunt trauma, usually sharp blow on the face such as a punch, sometimes accompanying a nasal fracture. Foreign bodies such as fingers during nose picking, digital trauma, middle ear, paratraumas such as from descent in aircraft as ascent in scuba diving. Nasal bone fracture, septal fracture, perforation, surgeries can also cause this. Nasal bleed may be due to fracture of facial bones, namely maxilla or zygoma. Vascular causes can be hereditary hemorrhagic telangiectasia, that is Osawe-Burendo disease, angioma. Aneurysm of the carotid artery can be one of them. Now, this is the best part of it, the pathophysiology of nose bleeding. And here the nasal mucosa contain rich blood supply that can be easily ruptured and cause bleeding. The rupture may be spontaneous or initiated by trauma. Nosebleed are reported in up to 60% of the population, with peak incidences in other under the age of 10 and over the age of 50, and appears to occur in males more than females. An increase in blood pressure, e.g. due to general hypertension, tends to increase the duration of spontaneous epistaxis. Anticoagulant medication and disorders of blood clotting can promote and prolong bleeding. Spontaneous epistaxis is more common in the elderly as the nasal mucosal lining become dry and thin and blood pressure tends to be higher. The elderly are also more prone to prolonged nosebleeds as their blood vessels are less able to constrict and control the bleeding. Now, the anatomy that we want to look at is very simple. The vast majority of nosebleeds occur in the anterior front part of the nose from the nasal septum. This area is richly endowed with blood vessels. We call it Chiesi-Bulge plexus. This region is also known as little area. Bleeding further back into the nose is known as posterior bleed and is usually due to the bleeding from Woodruff's plexus. A venous plexus is situated in the posterior part of the inferior meatus. Posterior bleeds are often prolonged and difficult to control. They can be associated with bleeding from both nostrils and with greater flow of blood into the mouth. Now, sometimes blood flowing from the sources of bleeding passes through the nasal cavity and exits the nostril. It is thus blood coming from the nose, but is not a true nosebleed. That is not truly originating from the nasal cavity. Such bleeding is called pseudo-epistaxis that we should be able to know, and examples include blood coughed up through the airway and ending up in the nasal cavity, then dripping out. Now, this is the best part again, treatment at home. When you develop nosebleed, kindly pinch the tip of your nose with 2 fingers for about 15 to 20 minutes, and you should be able to sit up and slightly lean forward until the head forward. But if the bleeding continues, we have the topical sprays which we can spray that they are vasoconstrictive and they have local anesthesia in it. Now, if medication doesn't work, it may be due to the posterior epistaxis, so we do the packing. We insert a gauze material or nasal tampon in the cavity as shown. This is now the hospital management. In case of recurrent episode, non-stop bleeding, now we admit you in the ward for possible further management with the tranexamic acid that help to promote blood clotting, or even for nosebleed, it can be applied to the site of bleeding taken by mouth, or we can inject you into the vein. We can use even silate injection or even orals. Vitamin K also we can use. Of course, if you are anemic, we can transfuse you some blood, and maybe when you have a low blood pressure, we can give you intravenous fluids such as Ringer's lactate. So management of nose bleeding can be case by case, as we mentioned the causes of nose bleeding. And the surgical part of it is we can do what we call cauterization. This method involves applying a chemical such as silver nitrate to the nasal mucosa, which burns and seals off the bleeding. Eventually, the nasal tissues to which chemical is applied will undergo necrosis. So some good hospitals normally do this. This form of treatment is best for mild bleeds, especially in children that are clearly visible. A topical anesthetic such as lidocaine is usually applied prior to cauterization. Silver nitrate can cause blackening of the skin due to silver sulfide deposits, though this will fade away with time. So the surgery is now ongoing bleeding despite good nasal packing. Now a surgical emergency can be done through endoscopic evaluation, and we can do ligation. And if the bleeding can also be stopped by intra-arterial embolization. The two, embolization and ligation, are particularly important during the surgery. But we say that there is no difference in outcome between embolization and ligation as treatment options, but embolization is considerably more very expensive, so you should be taking into consideration. Precaution. During period of nosebleed, there are several precautions you should employ for at least 2 weeks to allow healing of your nasal membrane. 1. Avoid vigorous activity. This includes jogging, lifting, yard work, aerobics, contact sports, or any activity that causes your pulse or blood pressure to increase. 2. Avoid warm liquids, warm foods, or spicy foods. Heat causes blood vessels to dilate, thereby precipitating bleeding. Avoid hot showers and baths. Hot tubs and saunas are off limits. Avoid medicine that alters the ability of blood to clot normally. This include over-the-counter medicines such as aspirin, ibuprofen, Advil, Motrin, and Naproxen. All those I've mentioned there. But Tylenol, that is acetaminophen, are always acceptable. Do not blow your nose. In this may forcibly disrupt clots along your nasal membrane. Sneeze through an open mouth. Avoid all trauma to your nose. Smoking is discouraged totally. Try to use a humidifier in the room in which you sleep or work. Keep your head elevated at this while sleeping. A lubricant ointment, batricitin AD ointment, polysporin may be placed. If you feel this video is very, very important for you and you are a student and you are in pediatrics ward, click the video that appears here about how to take history in pediatrics ward, that is pediatric history. Thank you so much. See you in the next video.